Hi everybody, my name is Megan Bauer and I'm here to talk to you today about the Depression Research and Treatment Program, a lab here at UB led by Dr. John Roberts. This upcoming semester we are looking for research assistants to help us run 2 randomized controlled trials. Both will be primarily run online, and your duties would be to talk to the would-be participants and go ahead and schedule them for clinical interviews with our interviewers. We need somebody who is highly conscientious, who can do all of this from an online perspective without needing a lot of hands-on help from other people. Because again, we're going to be entirely online due to the pandemic. And we want to make sure that we've got folks who are able to do that work on their own from home. Our randomized controlled trials are working on treatments for depression, which I suppose isn't too much of a surprise given that we are the Depression Research and Treatment Program. The first randomized controlled trial, which is going to function as my dissertation project, is focusing on an online mindfulness intervention. We're going to be giving that to college students who are experiencing subclinical symptoms of depression, and we're looking for folks here who have a history of depression in the past. We want to see if this online mindfulness program can help them in the future by reducing their current depressive symptoms. Our second randomized controlled trial, which is a part of the dissertation for an older PhD student, Eve Rosenfeld, is focused on the development of an app, a rumination targeting app for depression. And so she's not here to speak with you today, but again, the duties for these projects are going to be fairly similar. We're going to need you to talk to the participants, do lots of scheduling, coordinate different aspects of the treatments. So this is a big job, and again, we're looking for somebody who is detail-oriented for a lot of this. You'll look on that sheet that we've gone ahead and filled out for the Psychology Research Fair, and you'll find that you click on a link in order to apply. It's going to bring you to our website, and then you're going to download our application from that website. In addition to completing the application, please send that along with a CV or resume and a copy of your unofficial transcript. So that can go to me as well as Dr. John Roberts, the leader of our lab. Both his and my own contact information are on that sheet as well. If you have any questions, just feel free to reach out and ask them of me. I'm more than happy to answer any emails that you might have. We don't have any specific prerequisites for research assistants. I would say that folks are more competitive if they show an interest in depression specifically or an interest in clinical psychology careers in the future. Along with your research participation, we're going to ask that you also come to our weekly lab meetings and be prepared to discuss lots of topics about depression. So this might be current projects, this might be research articles that we go over together. We're going to teach you how to critically think about them, write some reaction papers, that kind of stuff. Our goal is to really make you more aware of the state of the depression literature and better consumers of research. In addition, those meetings very often take a bent specifically towards skills for our RAs. So if we have a lot of people who are applying for graduate programs in PhD or master's programs for clinical psychology, we might spend a couple of weeks working on interview techniques or how to apply those types of hands-on skills. So we really do try to tailor that to our group of RAs, which is why somebody who is so interested in clinical psychology might be a better fit for our lab than somebody who is interested in psychology as more of a side note to an interest in a different field. Again, any questions, just let me know. I'm always happy to help. Good luck finding a lab that fits you.